All right, guys, now let's talk about the cranial nerves. Big deal. This is going to be fun. I love the cranial nerves. I think we can make it super easy, and this is just loaded with test questions. I've gone through all the old tests, and I literally cut them out, and then I tape them to my notes, and I have so many different questions like taped to my notes here that it's not even funny. It's just all over the place, and I think most of them are super easy once you get the big picture. But if you think cranial nerves like, man, it's been a couple years since I've looked at this, and a lot of it seems kind of technical and hard, then it does feel like you're guessing because there's so many details. But I think we can break down the big picture pretty quickly and make it easy. Okay, so I want to do this first of all by looking at this chart with you, and I want to kind of go through the cranial nerves quickly to give you the big picture, and then we'll dive in more to the details of them. Okay, so as you look at this with me, these 12 cranial nerves, the first thing that I would pay attention to, if they asked you out of all 12 of these, which one of them is contralateral, okay? Meaning it has a nucleus on one side of the brain and the nerve crosses over to the other side of the brain and innervates a muscle on the other side of the brain. And this can get kind of technical, but in terms of the details of this, but in general, your answer is going to be cranial nerve 4. That's the one that's going to decusate. That's the other word they could use. It's going to go contralateral, so pay attention to that on the test. All the other questions, I would pick ipsilateral for the test. All right. Now, as you look at this, let's start with cranial nerve 1 at the top. You guys know cranial nerve 1 olfactory. You know it's going to exit through what? The cribriform plate, yes, which is where? In the ethmoid bone, baby, yes, okay? You guys know optic nerve, which is number 2, is going to control vision. You know that's going to exit through the optic canal, which is located where? In the lesser wing, yes, lesser wing of the sphenoid bone, good. Cranial nerve 3, oculomotor nerve. You guys know this is going to do eye movement. And the mnemonic you've seen many times is this one right here. SO4, LR6, cranial nerve 3 does the rest. Okay? So SO4 means superior oblique is going to be innervated by 4, lateral rectus by 6. All the rest are going to be done by cranial nerve 3. Okay? We're also going to talk about later on how cranial nerve 3, if you want to add it to this, is also going to do when it comes to right there, accommodation, pupil constriction. Right there where it says pupil constriction, you can write in meiosis. That's the word they might use on the exam. Okay, so eye movements, accommodation, and pupillary constriction. Cranial nerve 4 is going to do the superior oblique, so SO4. Remember, that's the one that decussates. Cranial nerve 5, you guys know this is a big daddy. Star the holy heck out of 5, 7, and 9. Those are the 3 that have shown up all the time on past tests. You want to know those really, really well. I'm going to build a big picture, and then we're going to hit this several times, but you'll know those really, really well. But with 5, you guys know there's 3 branches, V1, V2, V3. What are the 3 branches of V1? You remember the National Football League, which we'll talk about in a minute, NFL. V2 is going to be through the infraorbital foramen, right? That's going to provide sensation here to the cheek. V3 is the one that has sensory and it has motor, and the sensory and motor branches are just obliterated on the test. They want you to know those really, really well, like the lingual nerve, the inferior alveolar nerve, you know that. But there's some other technical ones we got to pay attention to. So just kind of put on your seatbelt, get ready for a good ride on that, on V3. You want to know V3 super, super well, okay? Cranial nerve 6 is next. You guys know that has one function, the lateral rectus, which is taking the eye like this, and abducting, abducting, right, which is out, okay? That's cranial nerve 6. By the way, on 6, this would be a really hard question, but if they ask you if there's too much pressure in the brain, like papilledema, right, or a brain tumor, right, you want to think, if they ask you what cranial nerve is most likely to be affected with increased intracranial pressure, it's 6. Okay, that's the one, stop reading the question. That shows up a lot on standardized tests. I haven't seen a lot on your specific test, but if they want to get technical, that's one I would pay attention to. Next one is going to be facial nerve. You guys know it's going to be the main one for facial expression. I'm going to teach you guys, when you see cranial nerve 7, you want to think motor, motor, motor. Like motor, 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 tons of motor, and oh, by the way, a little bit of sensory. That sensory is what? Anterior 2/3, taste, through what cranial nerve? Well, through what branch, I should say? The chorda tympani, which joins the what? The lingual nerve, right? Good. That's big, guys. You're going to nail that. By the way, what for salivation for 7, you guys remember what nuclei does salivation for 7? That's going to be the superior salivatory nucleus. Yes, right? When it comes to 9 right here, glossopharyngeal, you guys know 9, as we look at this visual again here of the tongue, you know 9 is going to control stuff in the back of the throat, right? So we said taste to the posterior 1/3. We also said swallowing, right? We also said it's going to deal with the gag reflex, the sensory portion of the gag reflex, right? So they can get kind of technical on this though on the test. So let me show you this visual to help you remember this. It's just very simple. But when I think gag reflex, you know there's going to be a sensory component that like feels that there's something in the back of the throat. That's going to be done through 9, right? There's also going to be a motor portion, right, that executes the gag reflex. So they would have to ask you which of the following provides the sensory portion or which of the following executes or provides for the motor portion. That's going to be cranial nerve 10, okay, which we'll get to in a second. So when you think 9, think sensory to the back of the throat. You want to think salivation. By the way, what nucleus is doing that salivation? You're going to go to 9 inferior parties a year, right? Inferior salivatory nucleus through the parotid gland. Yes, baby, right? We're getting this stuff. Now, I don't want to skip 8. So when you look at 8, vestibulocochlear, you know that's going to do hearing and balance. There's not much else I want to say about that that's important. Now, when we get to 10, I want you to circle that V of vagus, okay? And I want you to think of the V of uvula, right? When a patient goes, ah, and you see the back of their throat, that's what you're seeing, right? Sometimes you get a test question that's kind of technical about if a patient has a lesion, right, of a cranial nerve 10 palsy, where's that uvula going to deviate, to the left or the right? Or toward the lesion or away from the lesion. And I want you to say this phrase with me, okay? It's in your box right below this chart, but you want to say tongue toward, uvula away, uvula away. So if they ask about a tongue lesion, it's always going to go toward the side of the lesion. Uvula will always go away from the side of the lesion. Be all over that if they ask you on the test. My son, for example, has a split uvula. So we thought he was going to have a lot of problems with speech, right? Because you guys know, he didn't, thankfully, but you guys know with cranial nerve 10, it's also going to do talking, okay? In vagus in general, if you don't know the answer on the test, pick vagus. Because the others are pretty direct and easy. That's the one that has a lot of different functions that can get a little technical, so just kind of keep that nugget in the back of your mind. So guys, let me give you an example of the vagus nerve and how it's been asked on past test questions in terms of a technical question that you would want to pay attention to. All right, guys, let's go to the cranial nerve 11 next, which is a spinal accessory. I want you to think of this one, the spinal accessory, as the student nerve. Like a student saying, I don't know, right? I'm not sure. Like head turning, shoulder shrugging. So picture like 11s right here on my shoulders, like the number 11, right? Hey, by the way, where does the cranial nerve 11 enter the brainstem? You're going to pick what? You're trying to magnify that 11 and vertebral arteries. Yes, the foramen magnum. Good, okay? So pay attention to that head turning, shoulder shrugging. And let me show you how this was asked on an old test. Last but not least is cranial nerve 12, which deviates the tongue. Now let me show you a past test question on this. All right, guys, I want to show you 2 other questions that just kind of summarize some of the concepts we've covered just to kind of put you on the spot. And you'll get both of these right. It'll make you feel good about yourself. You're like, I'm getting this stuff. I can get all of these cranial nerve questions right, which remember, this lecture, when you think about the top points in this lecture, it's all about the cranial nerves. All right, guys, a lot of students that we work with find cranial nerves 2 and 3 kind of confusing. And I think we can clear up a lot of the basic points because sometimes just very basic things get asked on cranial nerves 2 and 3. And we can cover those pretty quickly with this one diagram. So let me sketch this out for you and make sure you're comfortable with this. All right, guys, so this is the right eye here, and this is the left eye here, and this is the optic nerve of the right eye. This is the optic nerve of the left eye, and this is what happens like behind the eyeball. If you could like go behind someone's eyeball and take a peek at where the cranial nerve 2 is going, like how is it going, this is what you'd see. And you guys already know that a portion of cranial nerve 2 on both sides crosses at the chiasm, right? Yes, so let me show you how that works. We said the nasal fibers cross there, and if you look in your notes, it's going to tell you things like that the cranial nerve 2 is going to end up in the lateral geniculate body, and that's going to go to the occipital cortex, and that there's also pupillary fibers. There's all sorts of things happening here, and it can be really confusing for people. So most of the time, students just kind of skip it and say a prayer and hope they can get by it on the test. But we can make this really simple. So you want to think right here of nasal fibers. So we're going to split this right optic nerve into a nasal and a temporal, the same for the left eye. And you want to think nasal fibers cross. So let's do that. So the nasal fibers cross on both sides. And then the temporal fibers obviously do not cross. So they're going straight to this location here. And on both sides right here of the brain, that's the LGN, lateral geniculate nucleus, which is in the thalamus, okay? Probably too technical to know it's in the thalamus, but you want to know that all these fibers are going to go to the LGN, and then from the LGN, they're going to the occipital cortex. That's the big picture. You guys already know the occipital lobe is where you have vision. Well, this is how it happens. But if some of you guys are wondering, okay, that makes sense. Cranial nerve 2 is going to provide the afferent or sensory component. So right now when you're watching me, light coming into your eye is being taken back to the brain through cranial nerve 2, right? But you also know that cranial nerve 2 doesn't just help you see, it brings information back. And then cranial nerve 3, okay, in this diagram, it's really cool. I can show you 2 and 3 in the same diagram. Cranial nerve 3 is what's going to allow your pupils to constrict and allow for accommodation. Remember that? We said cranial nerve 3 does 4 of the 6 EOMs, 4 of the 6 extraocular muscles, and it does accommodation and meiosis. So let's look at accommodation and meiosis right now. So when you think of cranial nerve 2 bringing the light back, okay, when you shine a light in someone's eyes, right, if you have trauma to a patient, they're coming in, you're checking them out, right, what's happening is light's coming back by cranial nerve 2, but not all of the fibers, okay, get to the LGN. Now hang with me, okay, this might seem technical, but it'll really clear it up. So these fibers, before they get to the LGN, some of them exit right here to what's called the pretectal nucleus. Don't worry about that, on both sides. And then the pretectal is going to communicate to the Edinger-Westphal. Ding, ding, ding. This has been on multiple old test questions. They want you to know where the pupillary fibers start, okay, for cranial nerve 3. They start right here in the Edinger-Westphal nucleus. Now, if you think, I don't remember Edinger-Westphal, or it's been forever since I've seen that, don't worry about it. I want to give you something like a happy place that you can go to in your brain right now. Put it like a big circle like I am right now around the Edinger-Westphal nucleus. That's where cranial nerve 3 starts its course. Now let's go back to the rule of 4s. Right? Do you guys remember what cranial nerves start in the midbrain, right? That's going to be cranial nerves 3 and 4, right? So guess what this is right here? This is in the midbrain. So right here, the Edinger-Westphal then shoots to the ciliary ganglion. The ciliary ganglion goes to the eye. So if they ask you on boards, which of the following ganglion provides parasympathetic supply, postganglionic parasympathetic supply for accommodation or meiosis, this is your answer right here. Right? So when you think of cranial nerve 2, you want to think that provides sensory back, right? Cranial nerve 3 is what's going to provide pupillary constriction and accommodation. Remember, pupillary constriction could be asked in terms of meiosis on the exam. Now, I know that's kind of quick, but big picture is you don't need to know every little detail, but some of the technical stuff that shows up can be represented easily by what we just shown. If you know that, you'll be golden for the test. All right, guys, now we're going to talk about the trochlear nerve, which is cranial nerve 4. You guys know that this one's going to innervate which muscle? The superior oblique. Yes, SO4, LR6, good. Now, let me ask you like a technical question. When you think of the superior oblique, like the function of it, and we'll cover this with the eye just very briefly later on, what's the function of the superior oblique? And the answer is that it's going to provide intorsion. So make a note of that, intorsion. That means it's going to take this eye and turn it, right? So if the right superior oblique, right, is going to turn the eye like this. Now let me ask you a question. What nucleus, okay, is going to innervate the right superior oblique? Is it going to be the left nucleus or the right nucleus that's located in the midbrain? Because you know 3 and 4 start where? In the midbrain, yes. So this is the only one that's contralateral. Remember that? So write that in your notes, contralateral or decusates. So it's going to be the left superior oblique nucleus is going to innervate the right superior oblique muscle, okay, in this eye. All right, so let's just do an example. Let me show you a really difficult question that was making you piece together what I just talked to you about. All right, guys, hard question, but if you get that on the exam, the key thing you want to know is that the superior oblique does intorsion, right? Intorsion. So if my right superior oblique, right, what's its major function? It's to intort. So if this doesn't work, right, I'm going to be tempted to do this all day, right? I'm going to tilt my head to the left because my right eye can't intort. That's how they can piece together a harder question on that. Just remember again that the superior oblique decusates, that's a more likely question, but if they want to get technical, that's what I would know. All right, guys, let's talk about the trigeminal nerve, which is cranial nerve 5. This is huge for your test. You know this. It has major ramifications for you in your career as a dentist. So you want to hone in on this big time. First thing I want you to know with cranial nerve 5, think of 5 as sensory, 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 like tons of sensory. And oh, by the way, a little bit of motor. That little bit of motor is huge for you. That's mastication, as you know. When you think of 7, it's the opposite. It's motor, motor, motor with a little bit of sensory. What's the sensory for that again? Anterior 2/3 tongue. Yes, okay? So let's look at this together. I want to show you this visual that you have in your book, okay, for cranial nerve 5. And as you look at this, the key thing I want you to hone in on here is the V3 branches right there. That auriculotemporal nerve. That's big. I'm going to show you a question on that in a second. The inferior alveolar nerve and the lingual nerve. Those three are ones that I want you to highlight. Remember, those are ones I've been stressing over and over again. But let me show you a past test question on the auriculotemporal nerve. So when you think of that nerve, it's all about TMJ. Now that gets hammered, I know, in the dental anatomy and occlusion. Ben hit that for you as well, but really hone in on that. That's great test questions. It's been hit over and over again, like literally every test that question gets hit. So make sure you pay attention to that. Now as we look at V1, V2, V3, for V1 you want to think again right here, it's the NFL, nasociliary frontal lacrimal. When you think of V2, you want to think primarily infraorbital and zygomatic. Okay, that's going to be your main branches. In V3, we're going to get into in a second. But let me draw this visual for you to kind of point out the branches in case they want to get a little technical on you. So the first thing I want you to see on this, when you think of V1, you're thinking of the NFL, okay? And the N is going to go here to the cornea, right? The F is going to go here to the forehead, so say F, forehead. The L is going to be lateral, which is the lacrimal nerve, right? So the N, nasociliary frontal lacrimal, okay? Now, if you want to split the F here into the frontal nerve, you're going to see in your notes, there's two branches, which is the supraorbital and the supratrochlear. You might remember the trochlea is always going to be medial. That's where cranial nerve 4, right? The superior oblique is going to hit that and curl around that. So that's going to be medial. So you can fill, instead of the F there, the frontal nerve, you want to know there's two branches, the supraorbital and supratrochlear, okay? Now, when you think of the V2, you can know that's going to be the infraorbital, again, in zygomatic. But if you want to split this up into like how to think about this in a fun way that's easy to memorize, is LOT-ZOT right here, the LOT. So the L would be lacrimal, the supraorbital, supratrochlear. Now this supratrochlear also goes down here to the inferior nasal portion of the lower lid. That's going to be the T there again. And then you've got the infraorbital, right, and the zygomatic. So that's an easy way to remember it, like LOT-ZOT for the branches of V1 and V2 in terms of how they provide circulation above and below the eye. Not super high yield, don't stress about that. But in your notes, we do talk a lot about the NFL. We talk about the branches of V2. So I wanted to have you kind of a quick visual for you to memorize that. Okay guys, as you look at the branches of V3 there, you want to pay attention to the sensory branches we've already talked about. So I know I've already mentioned these in the previous visual, but look at those right now and kind of star the lingual, the inferior alveolar, auriculotemporal nerve. Pay attention to those three because we're going to talk about them more in a few pages, but just keep reminding those are V3 branches, sensory branches. All right, next one, everybody, is the abducens nerve. This is going to be easy. You want to know it innervates the lateral rectus, which does abduction. You guys know it goes through the cavernous sinus and it hugs what in the cavernous sinus? That's going to be the internal carotid artery. Yes, and we said if there's too much pressure in the brain, this is your cranial nerve. All right, guys, now we're going to talk about the facial nerve, cranial nerve 7. This is a big daddy, huge on your test, all over the place. It's the #1 cranial nerve that keeps getting hit. We got some good visuals here for you and a couple good test questions. I want to start off with the test question just to see what your thoughts are on this. So to help you get these questions right, I want to show you this visual that you already have in your book, okay? As you look at this, you guys might remember that cranial nerve 7, again, is going to be motor, motor, motor with a little bit of sensory, right? When you think of motor, one of the big motor things you want to understand is going to be all about facial expression, right? And so as you look at this visual right here, you can see that the pathway for that starts in the cortex. And that UMN right here is upper motor neuron. So it goes from the cortex down to the pons. Do you guys remember what cranial nerves are in the pons? 3 and 4 midbrains, 5, 6, 7, 8 are going to be in the pons, 9, 10, 11, 12 medulla, right? So as it goes from here to here, right, that's the upper motor neuron, and then it's going to go from the pons, right, and it's going to exit out, as you can see here in this diagram, right? So if you have a lesion up here in the cortex, right here, an upper motor neuron lesion, that's also could be referred to on the test as a supranuclear. You're going to think supranuclear is a stroke. So you guys have seen many, many times and a patient with a stroke, they'll have a stroke on one side of the brain, right? And does it cause a contralateral or an ipsilateral problem? You guys know strokes, as you can see here in the diagram, are going to always cause a contralateral problem, and it's only going to affect the lower portion of the face. So say that to yourself now. Stroke equals contra lower. That's kind of what I would have in my mind. Contralateral problem on the lower side of the face only, okay? But what you saw in the test questions right there is they like to ask about problems with something like a lower motor neuron problem, which like Bell's palsy would be a perfect example. So if you screw it up right here, a lower motor neuron lesion, you're always going to get an ipsilateral problem that affects the entire side of the face. So you want to stress to yourself a lower motor neuron like Bell's, you can circle those L's of Bell's. You want to think of that as being a lower motor neuron problem. Lower motor neuron, if you interrupt it there, or like at the stylomastoid foramen, for example, you're going to screw up the entire side of the face. So like a Bell's palsy for an eye doctor is way worse in terms of how it affects the face than a stroke, because a Bell's is also going to affect the upper face right here. It's going to cause problems with the eyelid not being able to protect the cornea. That's called exposure keratopathy. Okay, your cornea is exposed. That's the big picture on that, is to understand, again, supranuclear and lower motor neuron problems. One other thing I want to point out is when you think about cranial nerve 7, you guys know it's obviously going to do facial expression, but don't forget that cranial nerve 7 is going to close the eye, all right? So when you think of the cranial nerves, you want to think of like this visual right here for how you open and close the eye. When you look at this, you want to think cranial nerve 3 is what's going to open the eye, okay? And it does that through the levator muscle. I didn't mention that earlier. We mainly stress with cranial nerve 3, it does pretty much all of the EOMs, right? But it also opens the eye. So we think of these pillars, cranial nerve 3, as opening the eye. Not a huge high yield item on the test by any means. But think of this 7, cranial nerve 7, as this hook right here that's going to close the eye, right? And it's going to do that through the orbicularis oculi. That's the main circular muscle that closes the eye. Another question I want to remind you guys of that I talked to you about earlier was, what does salivation, right? You might remember that 7 does salivation and also 9. And we said 7 does it through the superior, right? 7, superior salivatory nucleus. 9 does it through the inferior salivatory nucleus. Does that ring a bell? Good. So when you think of 9, cranial nerve 9, you want to think 9 inferior parties a year, right? Whereas 7, superior, is going to innervate the submandibular and sublingual glands, okay? The other two. So that's kind of the key thing I want to point out there. So guys, the next thing I want to point out is the branches of cranial nerve 7. This page is a big, big page. You want to hone in on it. It's very, very important. There's several technical details here that literally you can go online and YouTube videos or draw out the pathways. But I'm going to try and summarize it really fast because there's a lot here. And I've looked at the old test questions and can kind of hone in what they're detailing in terms of the pathways. So I want to start off by pointing your attention here to the greater petrosal nerve. So it says the greater petrosal nerve carries two things. It says number 1, taste, and number 2, parasympathetic. So let me show you this to you on a visual right here. When you think of cranial nerve 7, right, you know that it uses the superior salivatory nucleus. Now most people, when they look at that superior salivatory, they think it's all about, right, the fact that it's going to produce salivation. But the reality is this nucleus is going to do two things. It's going to do salivation, right? But it's also going to do lacrimation, all right? So when you think of this superior salivatory nucleus, both things. So think of cranial nerve 7, like back up, like 10,000 foot view, is going to help you cry and it's going to help you spit. Both two things, crying and spitting, both of those two things. So let's look at this now. When you look at the superior salivatory nucleus, it gives off this branch, right, called the greater petrosal nerve. This greater petrosal nerve is going to do two things. What are they, guys? Taste and parasympathetic, yes. So when you look at taste here in the diagram, I want you to pay attention. It's going to do that to the palate, okay, greater petrosal to the palate. It's also going to do parasympathetic, and it's going to do that to the pterygopalatine ganglion, from there to the lacrimal gland. That's where we get our tearing, okay, pterygopalatine ganglion to the lacrimal gland. Now when it comes to the chorda tympani nerve, right, for salivation, you want to think of that as also, as it says here in your notes, having parasympathetic and also having taste. So as you think about the taste portion, you've heard me say the chorda tympani nerve joins the lingual nerve, right? Well, in here in your notes, they want you to know that before the chorda tympani can join the lingual, right here in our diagram, we need to put a circle. And this circle right here represents the petrotympanic fissure. That's been on multiple test questions. You have to enter that fissure before you can join the lingual nerve to provide taste to the anterior 2/3 of the tongue. Now, we also said the chorda tympani does parasympathetic as well, and it's going to do that, as you can see in the notes, through entering the sublingual and submandibular glands to provide for that, okay, to provide salivation to those locations. So that's the big picture on Cranial Nerve 7's course. I would know those two very specifically, the greater petrosal, and I would also know the chorda tympani, and I would know that both of them have taste and parasympathetic functions. All right, guys, next one is going to be the vestibular cochlear. We're going to talk about this later on when we get into the ear. I know it's going to be like the highlight of your day. I know you can't wait. But when you think about this cranial nerve, where does it start its course? You guys remember 3 and 4 midbrain, 5, 6, 7, 8 pons, right? If they want to get specific, it's kind of the groove between the pons and the medulla, and that's listed in your notes. So kind of hone in on that, but the rest of the stuff on 8 we'll talk about later. All right, guys, now we're going to talk about cranial nerve 9, which is the glossopharyngeal, and I want to open up with a test question that's been asked on this in the past. So you guys are all over that. You're going to dominate that on the tests. Now I want to point your eyes to the notes for a second. I want to point out a few key features in the notes. Number 1, it says it's motored only one muscle, the stylopharyngeus muscle, right? So pay attention to that. Put an arrow to your right. That's a muscle in the pharynx, okay? And this is the only muscle that 9 is going to innervate, and that's unusual, so you want to hone in on that. You also want to pay attention to the fact that it leaves the jugular foramen. You guys remember what cranial nerves do that? It's going to be 9, 10, and 11 are in our jug. Good job. So you also want to pay attention to the fact of the branches. It says it joins cranial nerve V3, the auriculotemporal nerve. Whenever you see that, you're thinking TMJ, yes. And it says it here to encircle the medial meningeal artery to provide to the parotid gland. That's huge. I keep talking to you guys about cranial nerve 9 entering the parotid gland. It starts at the inferior salivatory nucleus, all that stuff. You want to pay attention to that language right there. It encircles that artery and joins that nerve, auriculotemporal. That's technical details that occasionally has been asked. It's a harder question, but pay attention to that. As you scroll down the lingual branches, it says provides sensory to the posterior third of the tongue, also provides taste to the posterior third of the tongue. You guys are all over that. And you also know that it's going to help with the gag reflex in the back of the tongue. And with that in mind, let me give you a past test question on this concept. All right, guys, this leads us to cranial nerve 10, which is the vagus nerve. I want you to think about that big V in vagus. I want you to think uvula, right? Remember, uvula away, tongue toward. When you look at this, remember I said if you don't know the answer on the test, pick the vagus nerve. Because you can see there's a lot of technicalities here. It's not stuff I would spend a lot of time focusing on, to be honest. There's a lot of technical stuff that hasn't been hit a lot on old tests. But some of the things I would pay attention to, you guys remember it exits through the what foramen? The jugular, which is going to be 9, 10, and 11. You guys know that the branches down here, there's a lot of them, but look at the pharyngeal branches. It says here, supplies all the striated muscles of the pharynx except stylopharyngeus muscle, right? Remember that one. That's going to be innervated by cranial nerve 9. Now, the other thing I would pay attention to your notes is this nerve, the recurrent laryngeal nerve for cranial nerve 10, the vagus nerve. This is the one that's been asked most frequently to know its course really, really well, guys. So pay attention to that in the notes. You can see that on the right side, it's going to loop around the subclavian. On the left side, it's going to loop around the aorta. That's been asked, so pay attention to that. You also know when you look at these branches, cardiac, pulmonary, abdominal, it's going to, big picture, going to go to the heart, the lungs, and the abdomen. Pay attention to that. Just write that in your margin to kind of summarize cranial nerve 10. All right, guys, now we're on to cranial nerve 11, the spinal accessory. Let me open up with a question to kind of reinforce what we talked about earlier. So pay attention to those two muscles that cranial nerve 11 innervates, the sternocleidomastoid and the trapezius muscle. Remember we said cranial nerve 11, head turning and shoulder shrugging. Those are going to be your main ones you want to pay attention to. As we talked about earlier, it's going to exit through the jugular foramen, okay? It's going to enter through the foramen magnum. Pay attention to that, and that's a subtle little detail that's been hit on old tests. All right, guys, so when you think of cranial nerve 12, you guys remember this is obviously going to innervate the tongue. As it says here in your notes, it's going to innervate all the tongue muscles except the palatoglossus, which is going to be from the vagus nerve. All right, guys, as you get into nerve fiber categories, the big thing I want you to pay attention to here is not the details. It's the big picture of understanding afferent is sensory and efferent is going to be motor, okay? And as we get into these different categories, I want to point your eyes to your notes here for a minute, where it talks about there's 3 types of cranial nerves. I've skipped ahead a little bit. It talks about how there's cranial nerves that have just GSE fibers, ones that have SSA or SVA, and then ones that have kind of a combination or more complex. And that third one, guys, the complex or combination one, is the one you want to pay attention to. And it says right there, 5, 7, 9, 10, and 11. Those are the ones you want to hone in on. Bottom line is I wouldn't memorize those three lists, but this is an old test question that kind of reinforces this structure on how they could be asking this on a test. So you guys can see how you got that question right without even understanding what SVA means. You understand that it's afferent, so sensory to taste. You obviously remember 7, 9, and 10 are going to provide the taste from what we talked about earlier. Okay, if you didn't get that, or now it looks familiar to you again, good. It's all right, we're going to get through this and reinforce it multiple times. All right, guys, now as we get into cell body locations, I want to point your eyes to Edinger-Westphal nucleus. You guys remember that one? If they ask you on the test, what's that going to provide, sensory or motor? You're going to say motor, right? Because it's providing for cranial nerve 3 to be able to cause meiosis and accommodation. You guys remember that from the diagram earlier? So again, I don't know that I would memorize like special visceral afferent or all the little details. I would understand motor, sensory, get the big picture down, but that's definitely one they could ask in terms of meiosis and accommodation. But the most important one on this page, and it's not even close, and this has been obliterated on old tests, is cranial nerve 5, understanding V1, V2, V3, and in particular, the nuclei seen here in your notes when it comes to GSA nuclei. Okay, you guys can see there the spinal nucleus, the main sensory nucleus, mesencephalic nucleus. These three have been hit really, really hard. And I would pay attention to it carefully. You can kind of stop and skim your notes on it. But let me show you some past test questions that have hit this over and over again. So when you guys see the main sensory nucleus there, I want you to think touch. That's a key point. And when you see that mesencephalic nucleus, I want you to think proprioception, okay? Those have been hit over and over again and make for great test questions. You guys also know V3 down here, so V1, V2, V3. V3 is also not only doing sensory, but it's also doing motor, right? And the motor it's doing is muscles of mastication. So look at this past test question to see how they ask this in a creative way. So I know Ben hit this in the dental anatomy and occlusion chapter, but you just want to reinforce the fact that in the box that the masseter temporalis, lateral and medial pterygoid muscles are innervated by V3. Those are your muscles of mastication. So the thing I want to point your attention to next is cranial nerve 7, the facial nerve. The nuclei here, these is kind of a review. It's going to make you feel good. You remember cranial nerve 7 uses the superior salivatory nucleus. 9 uses the inferior salivatory nucleus. Pay attention to 10, like we talked about, provides taste, as it says here, in the epiglottis region. That's just a review for you, but I want to make sure you hone in on those 3 points on this page. In terms of these nuclei, one other thing that I would point out that's a subtle thing is look at cranial nerve 12. It goes through the hypoglossal canal. You obviously know this is going to go to the tongue. I would just kind of hone in on the fact that that provides GSE fibers. That's kind of unique for that. I would hone in on that. Let me show you how this was asked on a past test question. All right, guys, the next heading that says detail on selected nuclei. Look at that with me for a second. You can kind of stop and skim these next 2 pages if you want. They're not high yield. They're mainly review, like Edinger-Westphal. You guys know that's in the midbrain. You know that's for cranial nerve 3. And it gives a lot of stuff in there like ipsilateral and contralateral. And bottom line is just remember what I talked to you about earlier. Everything's going to be ipsilateral unless you're talking about the superior oblique. That's a good rule of thumb to help you get those tougher questions right. All right, guys, the next heading we want to look at is the brachiomeric nerves, okay? And there's 3 there I want you to highlight, the 5, 7, and 9. Again, this is going to be a little bit of review again, so just kind of sit back and start patting yourself on the back and be like, good job, whatever your name is. Just keep patting yourself on the back and feel good about yourself, because remember we said cranial nerves is huge. So we went a little overkill, to be honest, in this section, but I'd rather be safe than sorry, so I'm going to just keep reinforcing a few quick details, all right? As you look in your notes here for cranial nerve 5, you guys know it says here trigeminal motor nucleus. You obviously know V3 is doing motor to mastication, but this is the picky little detail I would pay attention to, that it also provides motor to the ear, all right? And a lot of students forget that. They just think mastication, 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 and you already know what those mastication muscles are. You know it's the masseter, right? The temporalis, the medial and lateral pterygoid muscles, baby. You know that. But look at this past test question to reinforce the idea that V3 also goes to the ear. And that's going to be reinforced at the end of this lecture, all right? the rest of the information there, guys, you can kind of skim and reinforce, pause and skim. But the next big thing we want to hit to kind of really nail your time and maximize your time is sympathetic and parasympathetic. And I want to reinforce a few things. I know you've had this for years, but one of the things I want to point out, first of all, is that sympathetic is always going to be about fight or flight. I know you've heard that. Think of it as like increased blood pressure, like you're running from a cop, right? So you're running, right? Your lungs are going to expand, right? You're going to constrict your arteries and the peripheral arteries to shunt all the blood to your core organs, right? So you want to think in general, it's going to cause bronchodilation, right? It's going to cause vasoconstriction of your skin to move, again, that blood to your vital organs. And you also want to pay attention to, with sympathetic, that it's going to do what to your blood glucose? Look at this test question. So when you think sympathetic, you want to think all about increasing your blood glucose, right? You want to think about the fact of glycogenolysis, glycogen, right? Glycogen lysis. That's going to be to break down glycogen, which is storing glucose, right? You don't want to store it. You want to get it out of there so you can put it in your bloodstream, right? So when you think anything on the test to do with sympathetic, it's all about fight or flight, dilated pupils, right? Dilated lungs. You want to think of it that way, but you want to also think about blood sugar getting into the blood. Whereas parasympathetic is all about storing your blood sugar. So it's going to be all about producing glycogen storage, right? So think of it that way. It's not going to be about putting glucose into the blood. So when you think of parasympathetic, you guys know rest and digest. So digestion of food. Rest means obviously sleeping. And when you're sleeping, your pupils are going to be what? Dilated or myotic. It's going to be myotic, right? So think about parasympathetic as constricting your lungs and constricting your pupils. Remember, the eyes and the lungs always go together. So constricting the eyes, constricting the pupils, and it's going to be all about storing everything. So parasympathetic and insulin, any question on the exam about insulin, you want to put parasympathetic with it, because parasympathetic is all about resting, about storing, and insulin is the same thing. All right, guys, the next thing we want to look at is parasympathetic and sympathetic in terms of the preganglionic and postganglionic neurons. Some of you guys look at that stuff and you think your eyes roll back in your head and you're like, oh, Kyle, please don't take me there. Like you're going to go there kicking and screaming with me. But I think we can make this really easy. And this has shown up on old test questions in a variety of different ways. And it's super, super easy test questions when you get the structure. So let's reinforce this. You're also going to see me do a little bit of this in neuro as well, so you get the double review because it is important and it has been on old tests. So you want to think of the sympathetic system here as having a preganglionic cell body. Do you hear me say that? Cell body that's located in the thorax and lumbar regions of the spinal cord. That's why it's called thoracolumbar. So you've heard thoracolumbar for years. If you've always just kind of memorized that goes with sympathetic, you want to pause now and say, oh, okay, I get it. That means the preganglionic cell body is in the thorax and lumbar regions of the spinal cord. You guys remember the sympathetic system has a short preganglionic neuron represented like this. And then here is the postganglionic neuron right here. And that's going to be released into a site of action right here. And in general, this preganglionic neuron is always going to release acetylcholine right here. The postganglionic neuron is going to release epinephrine and norepinephrine. Okay. Now, let me show you a past test question that really nitpicked, and this is the hardest I've seen on understanding this postganglionic neuron in the sympathetic system. When you get to parasympathetic system, you want to understand, again, there's a preganglionic and a postganglionic neuron just like sympathetic. But in the postganglionic system, the preganglionic is going to be longer, okay? Pay attention to that. And the preganglionic neuron is going to release acetylcholine again. The postganglionic neuron is also going to release acetylcholine. That's why parasympathetic is oftentimes referred to as cholinergic, because it's all about, right, don't miss this, okay? I want to pound the board right now to reinforce this. It's all about what's released right here at the postganglionic neuron. So if acetylcholine is released, that's why it's called cholinergic. That's why every time you say the word cholinergic, if you've had pharmacology and you memorize these terms like cholinergic agonist, and you're thinking it's like hard for you to remember that, that's okay. Think cholinergic means parasympathetic. So a cholinergic agonist is going to promote parasympathetic activity, right? Whereas a adrenergic drug, adrenergic agonist, that adrenergic means adrenaline. That's epinephrine and norepinephrine. So anytime you see an adrenergic agonist, it's going to promote sympathetic activity, right? That's how you think through that and how you get those questions right, the pickier questions on boards. But let me show you a test question that was asked to reinforce the fact that acetylcholine is released here at the postganglionic junction, both in the parasympathetic system, right, but also at the neuromuscular junction. Check this out. Just as a reminder, guys, this acetylcholine here in the diagram, right, is always broken down by acetylcholinesterase. Okay, that's how it's broken down. If not, it would just be there forever and would cause parasympathetic effects forever. Just like in the sympathetic system right here, monoamino oxidase, MAO, is what breaks down norepinephrine and epinephrine. So in pharmacology, you guys have learned in school, like MAOIs, that drug like phenelzine. You may have heard that drug before, and you know that it's like the classic drug that they would ask for drug-drug interactions. Like this drug is contraindicated in which of the following situations, and it's like every single time it's contraindicated. Because what do you think an MAOI would do? It would break down it would stop the process of breaking down epinephrine and norepinephrine, so you'd have way more of this epinephrine and norepinephrine around, which would cause just sympathetic outflow out the yin-yang. It would just cause increased heart pressure, heart rate, blood pressure, all that stuff we just talked about, dilates the lungs, all that stuff. So it would really cause hypertensive problems, right? So that's how you want to think about what breaks down epinephrine and norepinephrine, which would be MAO, right? And what breaks down acetylcholine here, which is going to be acetylcholinesterase. All right, guys, we want to look at the heading that says sympathetic supply to the head and the neck. And the one you want to hone in on there is the superior cervical ganglion. That's the one you want to pay attention to. And let me show you this just for a second, just kind of remind you of the pathway. The sympathetic system is going to start up here in the hypothalamus, right? It goes down here to T1 or T2, which is like the second notch of your neck right here. And then it curls around your clavicle, right? And comes up here and synapses in the superior cervical ganglion. From this moment up, it can go up into the brain, right? But you want to picture the superior cervical ganglion as being right here on the angle of the mandible. Everything from here up is going to be postganglionic fibers, all right? So when you think about this logically, like if they gave you a hard test question, like a patient has Pancoast tumor. Have you ever heard of that before? Do you remember that? So Pancoast tumor arises at the, just write this in your notes if you don't mind. Pancoast tumor arises at the apex of the lung, so right here, right? So is Pancoast tumor going to affect preganglionic or postganglionic fibers? It's going to affect preganglionic, because you know everything from here all the way to the angle of the mandible is going to be preganglionic. From here up is going to be postganglionic. That's a point they like to hit on. They also just want you to know that the superior cervical ganglion from that point up is going to be postganglionic fibers. Going to be a good test question, so just kind of pay attention to that in case they pull that out. Guys, remember I told you that cranial nerve 7 is a big deal? You want to pay attention to that? Well, we're going to see in a couple pages that cranial nerve 7 is going to go through the pterygoid canal, right? And it's going to go to the lacrimal gland, as you remember, okay? But let me show you a past test question that wanted you to understand that there are some fibers that come from the superior cervical ganglion that are going to enter that canal, and they're sympathetic fibers, obviously, because that's what the superior cervical ganglion carries. And I just want you to take a look at this question and see what you think. Kind of a tricky question because it's hitting on the sympathetic fibers in that canal, and normally we don't give a rat's, you know what, about sympathetic fibers in that canal, because what we really care about is parasympathetic. And you're going to see that the greater petrosal nerve, right, is, as we talked about earlier, is what enters that canal, right, to provide parasympathetic supply, which is what we care about. But if you looked in your notes carefully, you would have seen there's something called the deep petrosal nerve that comes from the sympathetic fibers that's going to join that greater petrosal. Not a big deal, but I'm just showing you how they've kind of tied in the superior cervical ganglion in a tricky way on a past test question. Bottom line is, if they ask you something about the sympathetic nervous system and they list these ganglion and you don't know the answer, just pick superior. All right, guys, let's look at the parasympathetic system heading. So as you look at this, a lot of this is review. First off, it starts off saying that craniosacral, right, is where the system is oftentimes referred to. And what does that mean, guys? That means the preganglionic cell body, right, is located in the cranial and sacral regions of the spinal cord. So take a look at this past test question to reinforce the concept about the parasympathetic system that we've already hit. They love that salivation, don't they? They just keep tagging it over and over. You'll be ready for that. You'll nail it on the exam. As you keep reading the next few pages, you can kind of pause and skim them, the review. You know that cranial nerve 3, right, is going to go from the Edinger-Westphal to the ciliary ganglion to do meiosis and accommodation. You know 7, obviously we've nailed that several times. You can pause and look at that. And I want to hit on 9 here for a second because there's one little wrinkle I need to add to this that we haven't hit yet. So I'm going to draw this out on a visual just to make this really clear. So the big picture on 9 is you know that 9 is going to start with the inferior salivatory nucleus, right? 9 inferior parties a year, right? So it's going to start with the inferior salivatory nucleus. We're going to end up at the parotid gland. The details here that I need to add to this that we haven't talked about yet is that it's going to use the lesser petrosal. That should be easy to remember because think inferior, lesser if you want. It's going to innervate the otic ganglion, okay? That's been stressed multiple times on old tests before it goes into the parotid gland, okay? So that's kind of a key thing. Now, if you look at the otic ganglion paragraph there in your notes, it talks about how that you have the lesser petrosal nerve enters the otic ganglion, right? Then it joins the auriculotemporal nerve. You guys remember that? To reach the parotid gland. We talked about that detail earlier as well. So I'm just reinforcing what we've talked about a few times. That keeps getting hit on old tests.